And this video I'm going to make is about how to make a good impression. So this is mainly in the medical field, but I'm sure this could apply to mostly all areas of life. So how to make a good impression. So I'm right now rotating in a hospital that is like 110 miles away from my base hospital where I'm currently at. And I think, why am I doing this video? Because basically at this point in time, I've already been rotated and had to people have new impression about me or meet me from scratch in at least a dozen or more different occasions. So I've already learned from past failures. I've learned from actually personal success stories. So I'm gonna try to make it a short and sweet video. So first thing you want to do to get a good first impression is look professional, right? Professional enough for whatever job you are applying or you're actually in. So my hair was a little longer, so I got a haircut a couple of days ago, right before this rotation started. Just a haircut can make a difference. If your beard is horrible, that can also make a difference. So there is a saying that actually one of my cousins, who is an interventional cardiologist, told me when I was doing residency back in Costa Rica, and I'll never forget it. It is a quote that many people know in Spanish. It says, "El hábito no hace al monje, pero lo distingue," which basically translated to English is, the attire doesn't make the monk, but it distinguishes him. So it makes sense, right? If your first impressions are important, so I think I should have started talking about that. So let's just step back a second, and yes, first impressions are extremely important because let's start off with that, because I recall another fellow co-resident I had in Costa Rica, Dr. Rodriguez, and he once told me something that was incredibly wise, which was, when you're going into a new setting, into a new rotation, make enough so that they know you are worthy of being trusted, of handling your own time and all that. And after you do that, you can actually sort of be more yourself and be a little bit more flexible, right? So he used a Spanish saying once again, and this Spanish saying was, "Cría fama y luego échate a dormir," which would mean make fame and then rest on it, something like that. Which basically is just saying, like, the first impressions are so important that it will determine how people will look at you and how people will judge you later on. So the first impression will either make you or break you. So you don't want to start off a game with your left foot, right? You want to start off strong. You want to start off in a good light, because there's nothing worse than you being well prepared, you being ready for it. And for example, you get there and you're ready and you're supposed to start at 7 a.m. and you're arriving at 7:20 a.m. And that's already a bad impression, because you'll get there and you were supposed to be there 20 minutes earlier. So you're off to a bad start. And this is something I've experienced in the past. I would say one of my main weaknesses is that I run on Latin American or Costa Rican time, which is something I've been working on for a while. Even in Costa Rica, I was working on a little bit, I'd say, below average time-wise. So I was always struggling just to get there on time. And one of my fellow residents here in the States, Dr. Brookins, showed me this quote, which is, if you are, what is it? Many of you probably know this quote. If you are on time, you are late. If you're early, you're on time. If you're on time, you're late. And of course, if you're late, you blew it. So yeah, that's not exactly how the quote reads, but you get the point. Don't get there just on time. Get there 5 minutes early, hopefully, at least. Because oftentimes people have had a perception of me which has been like, oh, this guy is lazy. Yeah, because I got there 5 minutes late, 10 minutes late, or right on time. And then I work real strong. And I might even stay 1 or 2 hours after I'm supposed to leave. But they remember that I got there 5 to 10 minutes late. And then you have to struggle against that. Sometimes it might take days, sometimes it might take weeks, or even more, right? So you want to start strong. You want to start on in a good light. So first of all, you want to generate a good impression. Number one, show up, right? Show up, be up for the challenge. Number two is show up on time. So arrive at least 5 minutes earlier, depending on the complexity of what you're doing, even earlier, right? This is something that I am actively working on, because now I'm able to get to the place 1 minute earlier or right on time. In the past, I was usually getting places 5 minutes late, which, as I mentioned, won't look good at all. So that's the most important thing. After you get there on time, present yourself. So present yourself with, don't be selective with who you present yourself. If you're a doctor, you shouldn't just say hello and present yourself to your doctor and ignore the nurse, or ignore the patient care tech, or ignore the person who is in charge of cleaning, right? So I would recommend you presenting yourself, smiling. So just enter, smile at people, and if you interact with them and your eyes lock for a couple seconds, don't be weird and say, hey, nice to meet you. I am such and such, and I'm here for X, Y, and Z. So that's good. Try to remember names, but of course it's always difficult. I think I'm working on that. So for example, today I met a nurse named Dakota. I met Dr. Wilson. I met Dr. K. I saw Dr. Crocken. I was with another doctor, Beverly. I'm not sure if it's her name or last name. And I met a couple more nurses, I don't recall their names, and I am horrible at names. So I am great at faces, images. I will never forget if I actually saw you, but I might not remember your name, and even more so if I'm getting presented to 20 different persons in the first day. So what I would recommend you doing is write it down. So I took this little thing, veterinary specialist. So I got this, who knows where, but it's funny. I use this to write here in the hospital because it fits great right here. And I write down the names for the people I met. And there's some people that's a way I'm telling my brain, like, you should remember these names. Why? Because tomorrow, for example, I got an image. One of the nurses sent me an image about an interesting thing in the hospital. And I was able to answer back, hey, thank you, Dakota. So she's like, oh, the guy remembers my name. That's cool. If you just say thank you, yeah, they're like, okay, he's appreciative, but it doesn't make it personal. So you want to make connections. So that's the way you will actually make a good impression. Because you can be a genius. You can know the whole book by heart. But if you have no social skills and you cannot make connections with people, you won't, like if you're trying to get a job there, no one will push for you to get a job, because people will be like, yeah, this person is a genius, right? Yeah, but I wasn't even able to speak to him. I didn't socialize with them. I have no idea. I guess they're good. But so that's why you want to make connections. So you have to work smarter, not harder, which is another nice quote. So be smart about what you do. So another of my fellow attendants in Costa Rica, a cardiologist, which also has been a mentor to me, is Dr. Vindas. And he would tell me, meet the people. And this is so important. You have to meet the people, you have to talk to the people, and of course you have to know how to leverage yourself into getting what you want. So it's not exactly manipulation. It's just part of life, right? You can't ignore the facts. So yeah, you want to say hello to everybody, but if you have a limited amount of time, it would make more sense if you're a resident and you're rotated in an emergency department. It would make more sense that maybe the chief medical officer meets you as opposed to another co-resident. That doesn't mean that you'll be personable, that you'll smile, that you'll share, and all that. Use your time wisely. If you can socialize and connect with everyone, even better, right? So that's part of it, okay? The other part of it is actually be prepared for the reason you're there, because you're not there for just socializing purposes. If you're a resident, if you're an attendant, you're there to actually show them that you know your medicine. So be ready to help. So in the past, I've had situations where, for example, I was ready to see patients, but suddenly there was some difficulty. Maybe the badge still wasn't ready, or I wasn't still in the system, so that I could put in orders and all that. Instead of just sitting there and ignoring the possibility of interacting and helping out, you should be proactive, and you should be like, okay, I understand I cannot put in orders in the system, but I can also go and speak to the patients, and I can get a history, and I can do a physical exam, and I can come up with a plan, and I can share it with you. So that's also the other part, which is know why you're there and try to facilitate others' job. Show them that you're a team player and that you're here to work as, like, you believe in teamwork, because no man is an island. So if you're rotating somewhere and you're showing them, like, if their impression is this guy came here to rotate and actually he's made it easier on us, that makes everyone like want to have you there. So if you're somewhere and you're just being a smartass and you're just blurting answers and you're not thinking of the teamwork, but you're just trying to show everyone that you know your stuff, you're not gonna get far. But if you're there and you know your stuff, and you know that what you're gonna add might improve patient care, might ease up a process, or what you might do might ease in the workload of someone else, that's what you should do. So, for example, I'm not a respiratory therapist. They are usually who get an arterial blood gas for a patient. But we had a patient that I was seeing, and the patient needed an arterial blood gas. So I had already done my part, and the respiratory therapist was busy. So I asked, can I do it? And the nurses were like, really? You want to do it? Yeah, of course. And I went ahead, did it, got it, and the respiratory therapist just had to come and pick it up and was like, oh, thank you. You already did it. That's great. So I eased up the workload for the respiratory therapist. I made the lab come back quicker, and these are things that other people appreciate. So I was able to ask my questions, I was able to participate, I was able to learn, and at the same time, I gave something back to the team. I aided the team. You don't want to just take away from others, because if you're just taking away from others, they might not push towards your success, and you do want that, and you do want the help. I do understand that there is a point in time, for example, if you're a medical student and you're just starting off and it's your first clinical rotation, yeah, you will be asking questions and you will make the team go slower. But we understand that you still don't have the experience, you still don't have the capacity to actually make it quicker. But at all levels, you can always find something to do, something to help out the team. So for example, if you're a medical student, you might not be able to get the arterial blood gas, but you could pay attention to see where the respiratory therapist grabbed the kit. So next patient needs an arterial blood gas, you come in the picture and you go grab the kit, or you have a kit right here and you're like, okay, here, we can use this one. And suddenly the respiratory therapist will be like, do you want to do this test? That's when you'll be like, well, I don't want to delay you, but if you can teach me, yeah, of course, go ahead. And that's how you learn. So this is part of first impressions. We're still talking about the first impression in different areas. I already talked about showing up, being there on time, knowing how, connecting, trying to genuinely connect with other people, being respectful. So saying hello, being respectful to everyone, irrespective of who they are. You want to be respectful to the patient, to their family member, to the nurse, to the person who is just trying to mop the floor while you're passing by. You don't want to ignore this person. This is a human being as well and is vital for the hospital and yourself. So you want to say, excuse me, or can I pass through here? I can also go around over there. So those are things that will be good attributes and generate good first impressions. What else? You have to know your medicine, or you have to know why you're there. If you're invited to be somewhere, you're getting paid to be somewhere, you would have to work hard and show them, yeah, for the actual task I'm here, I know what I'm doing, or I'm trying to the best of my ability. Something else I'm going to say is, of course, no one starting on a job, starting on an experience, knows everything from the start. So there's where I would use this disclaimer, which is, I think, one of the best you can use. If you don't have an answer, you'll tell. If you're a student, medical student, and you get asked these questions, you have no idea, don't say, I don't know, and that's it. You say, be honest and say, I'm not sure about that, but I'll answer this question within the next whatever, right? If you're about to leave, tomorrow. Or if you're gonna be there the whole day, you have internet, you're like, I'll have an answer for this in the afternoon, okay? And follow up on it. Not just say it, because many times some students do the extra step of saying, I'll have an answer, and if you don't remind them, they won't even say anything. Then that generates a bad impression. So follow up on it. And in the afternoon, bring it up and be like, hey, I went through such and such topic. I wanted to tell you my thoughts about it. What do you think? And that's great. And if you want to be even better, you can be like, and I also saw, now that I was reading this, I saw that something new, something you think that could add to the other person's knowledge or arsenal without coming off as a smartass, okay? So yeah, I'm telling you things that I've learned through my process. In general, I've worked very hard. I've been hard worker basically since I'm in high school. So oftentimes I've had a lot of answers in my brain, but I haven't known how to convey them. And I've been on all sides of this story. I've been on the side that I've shown way too much capacity, in the sense that I have gone to rotations, for example, in Minnesota, and I overdid it. I was ready to answer everything. I wanted to show them I had all they needed for me to become a resident in their program. So I saturated them. I stayed in the hospital till 9 p.m. almost every day, working on presentations. I asked them, I want to present morning report tomorrow. After that, I asked them, can I present noon conference as a shadow-in student, which usually isn't done. After lectures, I would add some sort of input. And sometimes, once I added input, it was a pulmonary hypertension lecture. And after they finished, I added my input. And I spoke after the attending spoke, which I didn't know it was the attending. I thought it was a medical resident. And after this medical resident spoke, I said like, oh yeah, and based on what the doctor just said, you could also take into account that you could do this and that. So I didn't see the audience as well. I wasn't able to know my audience. That's another very important thing, which is know your audience. Know that there are moments that even if you have the answers, you should better not say them unless your emotional intelligence level is sky high. And for that, you have to, it's everything. Everyone, they'll listen to your verbalization. They'll see your facial expression. They might note the most minor thing, or sometimes they might think that you're just trying to boast and you're just trying to show that you're superior to someone else. And that's not going to work out. So for example, in this that I just said, I shouldn't have spoken over what the attendant said, because it's not going to look good, even if it's as a shadow-in physician from Costa Rica who is trying to become a resident in this program. Because what that tells them is like, this guy is way too much. This guy is way too much. And yeah, he's going to be a problem, because everything in this life is a balance. There's a moment for everything. And that's something I've learned throughout my process or career, that even the truth, I believe in the truth. And in the past, I believe that the truth, no matter what. And I thought everyone should think like that. So I would say the truth. I would try to be respectful, but I would just feel the urge, and I would just be like, no, that's not like that. And it was maybe a minor medical detail. Maybe it was on a session, cardiology session, someone was talking about bacteremia secondary to Streptococcus sanguinis, and they would say that it was a group B strep. And I was like, no, Streptococcus sanguinis is not a B strep, no, group B strep. And I would say the answer, and then someone would ask me at the end of the thing, hey, are you an infectious disease resident? And I was like, oh no, I'm cardiology. And they'd be like, oh, okay. And I would feel like, oh, that feels good, because they think I'm infectious disease because I said this. But that was one person. The rest of the room probably was like, was it necessary that this guy pointed this out? Like, is it going to make a change? If it's going to make a change, you should think about maybe saying something. But you have to use the right timing. And sometimes saying it in front of the whole audience wouldn't be a good idea. So sometimes there are some things that are better left unsaid right there. And if you think it's very important to mention this about the strep, you let the conference finish, and after that you can go and speak to the presenter, and you can be like, hey, I noted a great presentation. I noted your, you mentioned strep sanguinis. Was that group B strep? And you just let them, maybe they can say, oh no, that's not group B. I think that's was it group D or F? To be honest, right now I don't remember, but that's something that happened, and I had step 1 information extremely clear in my brain. I think it's group F. Okay, yeah, group F. I'm almost certain. Let me know if I'm incorrect. But you can just note that, and some people will even take it wrong that way, but it's gonna be one person instead of the whole room. So you have to know your audience. You have to know when is a good moment to speak out, when it isn't. So I'll tell you more about my story with the Minnesota people. It was a funny story, but in summary, you can do it. Most people, what happens is they don't even show up. They give minimal effort. They don't buy all the chips. And that's bad. That's bad impression. Most people here are aware of how that looks like, but most people here haven't lived the other side, which I can now attest that you can also overdo it. You can be too much. And actually, this program told me, like, indirectly, they told me, you're too much. Like, we have nothing to teach you, basically. So I'm like, oh man, I should have just rested. I just should have just left the hospital 5 p.m., been a little more chill, known better when to speak and all that. So everything in life is gonna be a balance. We have to deal. Every human brain is a universe of its own. So yeah, you have to try, but in the end, you have to have your consciousness clean. There are people that even if you do everything right, they'll just hate you, and that happens. And that has happened to me way too many times to understand the human psyche much better. Okay, but for first impressions, those are the main things I'm telling you. Just show them you are very interested. Show them you're there to learn. And for example, one of these days, or I've been told, I told someone I was a resident, and they told me, okay. And they mixed up and they said, yeah, when I have students like you, and then the attendant is like, well, yeah, you're not a resident anymore, but I'll say you're a student as well. And I'm like, yes, sir, I'm a lifelong student, because you have to understand that if your ego gets inflated, right, you're gonna become unteachable. So as a martial artist, be always a white belt. Those are the people that learn the most, that become the most prolific in any sport. Is when you always live the white belt mentality. You're always there to learn. Even if you're a black belt, you know that the white belt might teach you something, and that's the way you become your best version. Compare yourself with your own self, with who you were yesterday. Don't try to compare yourself with others, because if you're trying to get a good impression and you see someone who's very good and you just start competing with them, you'll just show. This shows. People know. And yeah, don't exude those negative emotions. Have the confidence in yourself that yesterday I was not this better version of myself, and tomorrow I'll be better. That's it. It's not the competition is against yourself. And other things for first impression, just be there to show genuine interest. And if you do all those things, you will be fine. Try to help, as I mentioned. Try to show them you're part of the team and you're ready to work on teamwork. Respect everyone. Smile often. Try to lighten up the environment. So don't be so stressed out, right? I'm thinking what I'm going to say next. I'm waiting for him to finish speaking because I have this input. Learn that if you actually listen, sometimes you don't even have to speak. If you listen, you might just ask another question, and that might be better than you answering the best answer, crazy diagnosis. You got it right, but you didn't even listen to what they were telling you, and they won't like that. So listen. That's very important. That's why we have 2 ears, 1 mouth. That's it for this one. See you in the next one. Hope you liked it. Let me know what I'm missing for a first good impression.